Hello and thank you for joining us on the Capitol Report on NTD Television. I'm Steve Lance. Here's a look at some of the stories we've been covering for you today. In the heart of the nation, a massive and diverse crowd marched for freedom from the vaccine and mask mandates. We spoke to attendees and speakers to find out why they're opposed to unilateral mandates for masks and vaccines. There were many highly respected doctors at the Stop the Mandate rally in Washington, D.C. We caught up with two of them to find out what brought them from different parts of the country on a cold Sunday in the nation's capital. Attorneys general in 3 states and Washington, D.C. have filed a lawsuit against Google. The suit alleges the tech giant collected users' location data without their permission. In the heart of the nation over the weekend, thousands of Americans spoke out against COVID-19 mandates with a march along the National Mall. Some doctors spoke out about why, in their opinion, these mandates defy science. Others shared how the various mandates have uprooted their lives, which includes being fired from their jobs. We were there at the rally this weekend. Here's NTD's Melina Wisecup with a look at that large event.
The rally gathered what appeared to be tens of thousands of Americans from Florida to New York to Colorado and many states in between.
I've traveled over 300,000 miles, talking to people all around the country, in the heartland, in the Midwest, in urban cities and suburban cities. And I got to tell you, all Americans are saying we need to stand up against this tyranny.
The rally was to oppose the mandates alone, but it was not an anti-vaccine march, as labeled by some. We spoke to many people, some vaccinated, some unvaccinated, and we quickly found out that this movement has no limit on political party, race, or background.
Funny you should ask, I'm a Democrat. So a lot of people think that this is a Republican or a right-wing argument. I'm one of the founders and my co-founders are Republicans. So absolutely bipartisan, it's irrelevant. This is a medical science issue and that's what it should have been from day one. I think it was deliberately politicized, unfortunately, to divide us.
Patriots from all walks of life, not Republicans, not Democrats, not libertarians, Americans. This is encouraging and I encourage everybody to really pay attention to what's really happening out there.
An attack on freedom is what they say they're standing up to. Many protesters told us they feel the mask and vaccine mandates are nothing more than a power push.
I think that there's a push to create a two-tier society where the compliant ones can go about their lives and the uncompliant have to stay at home and locked up.
My God gave me freedom. I have freedom in my existence, and so that's what this stood for, is that I'm not afraid of COVID.
Some of those protesting have lost their jobs for choosing not to get the COVID vaccine.
You'll see there's a lot of firefighters that are here today that have been on leave without pay for going on 90 plus days. There's a lot of others that have been submitted documentation that they will be terminated if they don't get vaccinated.
And this woman from New York also lost her job. She points out that the mandates and restrictions are not limited to just adults.
Wow, so you're saying that people, when they try to get into a restaurant in New York City, if the child doesn't have a vaccination card, that they're getting kicked out?
That is absolutely correct. The children, the parents, I was recently arrested and recently a 9-year-old was kicked out of the museum because she did not have proof of vaccination. That is correct.
Melina, a major question discussed during the protest is whether the science really justifies the mandates. Many well-known doctors have argued that some scientific perspectives have been silenced and some renowned doctors have been censored for disagreeing with the push to get the entire population vaccinated. Some of these silenced doctors visited Congress today to testify about this. Melina, what can you tell us about that meeting?
So today's panel discussion was led by Senator Ron Johnson, and this type of discussion are the types that are actually most of the time censored because they do offer an alternate point of view about masks, natural immunity, and vaccines. Now, about vaccines, one shocking concern that some of these doctors laid out today is that the vaccines may actually be driving Omicron infections among the vaccinated. Let's listen.
Omicron is not only resistant to the vaccine, but its infectivity seems to be facilitated by the vaccine. And in my opinion, this must stop for the sake of the world.
We have some brand new data from the UK and Scotland this week, the 3rd week of reporting for 2022, which demonstrates conclusively that the vaccine is driving the 2nd dose and 3rd booster dose It's driving massive infections in the vaccinated, and it is a big, big problem.
But there was one doctor who seemed to have disagreed with this point. But that's really the point of having these types of discussions and panels, is to bring these scientists and researchers together to question mainstream views and have open scientific debates. Because we know oftentimes those voices who do question the federal government and the mainstream views, those are the voices that are often silenced. So Senator Johnson has held many of these discussions for months, and we expect him to continue with these types of discussions as long as these mandates are in effect. Steve, back to you.
Yesterday, I was at the Lincoln Memorial where I was able to catch up with two very prominent doctors who've been quite vocal about stopping what they say are unilateral mandates. Here's our interviews with cardiologist and heart specialist Dr. Peter McCullough and emergency room physician Dr. Pierre Corey. We're with renowned cardiologist Dr. Peter McCullough here in Washington, D.C. at the Lincoln Memorial at the Stop the Vaccine Mandates rally. Doctor, thank you so much for joining us.
Yeah, this is a historic day for Americans. This was really an expression by highly qualified doctors that have done the research and that have shown that early treatment can end this pandemic by reducing the intensity and severity of disease and reducing the chances of hospitalization and death in our highest risk seniors. This basically means that the vaccines broadly used aren't needed. And in fact, we have seen far too many vaccine injuries and now vaccine failures. With the Omicron variant, there's effectively no coverage of these vaccines against the newest form of the virus.
So, Doctor, tell us from your perspective, has there been a lot of misinformation, or would you even say that no information, leaving out information, is a form of misinformation?
Well, the government has certainly been in oblivion in terms of early treatment. Our CDC, FDA, and NIH have had no effective messaging on early treatment, even the emergency use authorized monoclonal antibodies, which are safe and effective, and even on the new Merck and Pfizer drugs, which they're basically absent in terms of the media, despite being recently distributed across the United States. And then these agencies have actually engaged in misinformation. And what we know there is that with ivermectin, as an example, there was an intentional misinformation campaign against the use of ivermectin by the NIH and the CDC and the FDA. It was actually fully taken up by the AMA, which has an official campaign to abolish the use of ivermectin.
There's so many of these examples that just really raise your eyebrows. Would you say that the CDC and these government bodies have almost played possum when it comes to the issue of natural immunity?
They've ignored natural immunity, which is robust, complete, and durable in terms of the lethal strains of the virus. It was only until we got to the Omicron variant, which there was a breakthrough, and individuals who are previously immune could get a mild Omicron syndrome. But natural immunity is the end of the pandemic. Remember, as we all become naturally immune, COVID-19 is no longer a threat to our lives. And the failure of our governmental agencies to recognize natural immunity has basically created unnecessary suffering, unnecessary testing, unnecessary masking and social distancing, unnecessary compliance with all kinds of measures that are designed for the susceptible. Those who are naturally immune are no longer susceptible to fatal disease.
And the CDC has just come out last week and said that it is exactly what you said. It is more powerful in protecting against the virus than the vaccine.
It's infinitely more powerful. All the vaccines waned in efficacy against the legacy strains. They basically, 22 studies showed that the vaccines ran out of efficacy after 6 months against the strains that are now extinct. With the Delta variant, we only had about 20% vaccine efficacy as published by Young Zhu and colleagues in JAMA, and now with Omicron, we have effectively zero efficacy as published by Hansen from Denmark and from the UK Public Health Agency. All we have at this point in time is biased, confounded, and I think invalid hospitalization data. The U.S. agencies still make the claim that the vaccines protect against hospitalization, whereas we see no evidence of that in the U.K., Germany, South Africa, and the rest of the world. And I can tell you, the United States is not that different than the rest of these countries. Something is wrong, and I can tell you something is wrong with an incorrect, invalid claim that the vaccines reduce hospitalization. I don't think think it's supportable.
Now, Doctor, before I let you go, I think it's fitting to ask you this question. Like I mentioned earlier, you're a cardiologist, and there's a case right now. There's a gentleman, his name is David Ferguson. He's in Boston, Massachusetts. He's literally in the hospital waiting for a heart transplant. He's next on the list. He has 2 children, 1 on the way, and the doctors are saying that they're not going to give him that heart unless he gets vaccinated. Ethically, morally, anything, what do you make of this?
Denying a patient an organ transplantation on the basis of an investigational, ineffective, and categorically unsafe vaccine is itself unethical, immoral, and from a clinical and civil perspective, it's illegal. These vaccines cause heart damage. It's called myocarditis. Under no circumstances would a good doctor ever expose a patient with heart failure who's awaiting a transplant. Under no circumstances would a doctor expose that patient to one of these vaccines. Jessica Rose and myself have published in Current Problems of Cardiology that risk of myocarditis extends up to age 50, and it's substantial. And subclinical cases in patients who already have severe heart dysfunction can clearly put them over the edge. It can be fatal. Those doctors need a re-examination of their position on this because it's creating personal harm to that individual. It's effectively a form of personal injury.
Dr. Peter McCullough, thank you.
Thank you.
Dr. Pierre Corey, thank you so much for taking a moment to chat with us here at the Stop the Vaccine Mandate rally.
Hi, thanks for being here.
So, Doctor, tell us, what brings you out here in the freezing cold in Washington, D.C. today?
Yeah, so it's a number of things, right? It's not just about the vaccine mandates. There's a number of infringements on our freedoms. And as a physician, I personally am here about the cause that I feel most strongly about, which is the restriction on my ability to practice medicine. You know, the hospital, those of us who spoke out and have any scientific opinion that diverges from the official recommended one, we're losing our jobs, we're being attacked, our reputations are attacked, our credibility is attacked. I can't get access to life-saving medicines for my patients because they're not profitable medicines. And so they're being discredited, and we're trying to fight back against that. Those are the freedoms that I've felt the most. The loss of those freedoms have really affected me the most as a physician. I can't care for my patients anymore.
Now, I think, Doctor, there's a lot of people out there that wind up getting sick from this virus, and if they haven't been vaccinated, or even if they have, they can't really figure out what to do, what next. Are there things to do? Are there medicines that could potentially help?
Absolutely. So my standard answer to that is you go to our website, which is flccc.net. We're an organization, a nonprofit organization made up of physicians our only goal was to disseminate that information that you asked about. What to do if you get sick, what to do to prevent you from getting sick, how to avoid hospital with early treatment. And we have combination protocols for every phase of the illness, from prevention to early treatment to hospital and even long-haul COVID. And so that information is present. It's on our website. We are having difficulty disseminating that because we're fighting a war of information. The powerful interests that are seeking to suppress that information, they're using widespread censorship as well as propaganda to try to discredit the science and suppress the science. And so I'm glad to talk to you today because I just want to direct your listeners, your viewers, to go to our website. It's just pragmatic, sound, good medicine that works. And so they need access to that information.
Virginia counties are suing Governor Youngkin over his executive order allowing parents to decide if their children should wear a mask in school. The suit alleges that state law requires schools to follow federal health guidelines. Youngkin's executive order states that a previous mask mandate was for Delta, not the Omicron variant. Also, that mandate came at a time when vaccines were unavailable for younger children. Youngkin's order says children often use masks incorrectly, and wearing masks for a long period of time is not effective. Further, masks can get dirty, inhibit communication, and impede emotional and social skill development. For these reasons, the order states parents should have the ability to decide. Youngkin, however, urged parents to listen to school principals until the courts make a decision. Attorneys general in D.C. and 3 states have filed a lawsuit against Google for collecting data from users without their permission. Washington, D.C. Attorney General Karl Racine said that Google is deceiving users and invading their privacy. The suit alleges that Google collects and profits from people's location data even after users opt out from sharing it. Texas, Indiana, and Washington State are joining the lawsuit. Texas Attorney General Ken Paxton said that Google systematically lies to millions of consumers in order to stack billions of dollars into its coffers. The Supreme Court hears cases on use of race in college admissions. And the U.S. Department of State is condemning Beijing for imprisoning 11 Falun Gong practitioners just weeks before the Winter Olympics are set to begin. Taiwanese fighter jets scrambled to warn 39 Chinese aircraft on Sunday. It's the largest incursion into Taiwan's air defense zone by Chinese warplanes since last October. This comes shortly after President Biden appears to signal that the U.S. would not act militarily if Russia invades Ukraine. Hello and welcome back to NTD's Capitol Report. Today, the Supreme Court announced that it would review cases on the use of race in college admissions. The Students for Fair Admissions lawsuit accuses Harvard and the University of North Carolina of race-based discrimination that negatively affects Asian Americans. The North Carolina case also involves white applicants. Both universities said that they use race as one of many factors in admission decisions.
We strongly believe, this administration, in the benefits of diversity in higher education, and we take very seriously our commitment to advancing equity and equal opportunity for historically underserved populations.
According to the plaintiff, the use of race in college admissions decisions is unconstitutional. The State Department has just condemned the Chinese Communist Party for sentencing 11 Falun Gong practitioners to prison for exercising their religious beliefs. In an email to the Epoch Times, the State Department says it's calling on Beijing to, quote, immediately end its depraved abuse and mistreatment of Falun Gong practitioners, release those imprisoned due to their beliefs, and address the whereabouts of missing practitioners. Falun Gong is a meditation practice rooted in traditional Chinese culture based on the principles of truthfulness, compassion, and forbearance. Beijing launched a persecution campaign to eradicate the practice in 1999. The Chinese Communist regime handed down the sentences just 3 weeks before the Beijing Olympics. These practitioners of Falun Gong have already been detained for 15 months before getting a hearing last October, and at least one lawyer lost his license for taking their case. Senator Rick Scott told NTD's sister media, the Epoch Times, that the Chinese Communist Party is relentless in its campaign against religious minorities. The persecution against Falun Gong has gone widely underreported due to the CCP's influence and economic ties to many Western media outlets. NBA player Enes Kanter Freedom has been very outspoken on the Chinese Communist Party's human rights abuses. Recently, he has got an invitation to visit China, but right after he accepted it, his host blocked him from social media. Kanter Freedom said he would accept a visit to China as long as he gets to visit the Uyghur concentration camps to see the, quote, real China.
I don't need a lecture tour of China. I don't want to see no propaganda. I want to actually get to see the real China and show the whole world that what's going on. And so, yes, I actually do accept his offer.
This was his response to Yao Ming's comments to invite Kanter Freedom to China for a better understanding. Yao was a former NBA player and is now the president of a state-affiliated Chinese basketball association. But one day after Kanter Freedom accepted the offer, he found himself blocked by Yao on Instagram. Kanter Freedom's name has also become unsearchable on Chinese websites. Another former NBA player, Kwame Brown, tells NTD he supports Kanter Freedom for speaking up and going against the grain.
I support what he's doing. I think he's a very brave person for taking the stance that he's taken, given the position that he's in, being a current NBA player. He's definitely going against the grain. So I support anybody who's not afraid to speak up for freedom.
On Sunday, Taiwan reported the largest incursion into its air defense zone by Chinese warplanes since last October. Taiwan's defense ministry said Taiwanese fighter jets scrambled to warn the 39 Chinese aircraft, mostly fighter jets, in the latest incursion. Taiwan's missile systems were also deployed to monitor them. Taiwan calls Beijing's repeated nearby military activities gray zone warfare. It's aimed to wear out Taiwan's forces and also to test their responses. China's launch came the same day the U.S. Navy sailed 2 carrier strike groups in the Philippine Sea. The Pentagon said the 2 carrier groups have entered the disputed South China Sea for training on Monday.
We do this to strengthen our integrated at-sea operations and our combat readiness. I would reiterate that all the training will be conducted in accordance with international law in international waters.
Will Russia invade Ukraine again? That is after it seized the Crimean Peninsula in 2014. That's the big question. U.S. officials say it could happen at any time, and they're preparing on multiple fronts. The world is watching and waiting as Russian troops amass at the Ukrainian border. U.S. officials have warned invasion could be imminent, but Moscow has said it has no plans to invade. Secretary of State Antony Blinken says diplomatic means are preferred, but other measures are on the table.
The paths are clear. Diplomacy, dialogue, seeing if we can build collective security in a way that is good for everyone is clearly the preferable path, but we're prepared either way.
In the meantime, the U.S. has been sending weapons to the Ukraine and trying to get some Americans out. The State Department is reducing staff levels at the U.S. Embassy as well. Democrats and Republicans are coming together to support a free Ukraine, but lawmakers differ on how Washington should respond. Democratic Senator Chris Coons told ABC Sunday he agrees with applying some sanctions, but not all of them.
But the very strongest sanctions, the sorts of sanctions that we use to bring Iran to the table, is something that we should hold out as a deterrent to prevent Putin from taking the last step of invading Ukraine.
But Republican Senator Joni Ernst is calling for very aggressive action immediately.
So we do need to go ahead and impose sanctions on Russia now. We need to show them that we mean business and we will be there for Ukraine should they invade. Once an invasion happens, lives are lost. You can't go back from that.
Biden held calls with European leaders to discuss the Ukraine situation earlier today. That's all we have for you tonight on the Capitol Report. Thank you for tuning in. From Washington, D.C., I'm Steve Lance, and we'll see you tomorrow.